My name's Jonathan Cohen. I am a human rights lawyer and a public health advocate, originally from Canada, based in New York City. And currently I work at the Open Society Foundations, where I direct our global public health program. What I'll remember most, honestly, is the fear. The fear of not only getting sick, but getting sick and having to go to the hospital when the health system is completely overwhelmed. The fear of that happening to someone I love in my family, the fear and concern for my aging parents and my aging in-laws, the fear on behalf of my colleagues, who I have a very close relationship with, who suffer diverse vulnerabilities related to chronic disease, related to socioeconomic status, related to isolation, the fear for my community, my neighborhood, my city, the effects of poverty and destitution, the fear for the country, for the world, and the way in which our political leaders last year stoked that fear, rather than calming us, instead divided us. And that was hard for me because I'm a naturally optimistic person. So for a natural optimist to confront levels of fear that are that acute, it changes the way you look at the world. I've been lucky, and certainly one of my reflections on the last year is that, COVID has reminded me of how much I have to be grateful for. It's a pandemic that everybody's vulnerable to, but it obviously disproportionately affects people who cannot work remotely, people who live in dense congregate housing, people with serious underlying health conditions. And I'm fortunate not to have been vulnerable based on any of those factors. So, my husband and I, we like to say we were solidly COVID middle class. We were neither escaping to our villa in the Hamptons, nor were we homeless and out of work. We were working from home. Open Society Foundations is a global private philanthropic organization that is endowed by George Soros, and our global mandate is to advance open society principles. And these are principles of democracy, human rights, pluralism, human diversity, and broadly justice. And we work all over the world. I've been living with HIV for just over a decade, and as soon as I got my COVID vaccine, I was sitting in the area that they reserve for medical observation in the vaccination center, and a wave of hope came over me that reminded me of the wave of hope that came over me when I first became undetectable as a result of HIV treatment. And it was a kind of hope that had to do not only with my medical condition and with the likelihood that I would no longer get sick and die as a result of this disease, but also a hope that was associated with no longer being infectious or contagious to other people. And that brought a kind of restoration of my humanity and my dignity, right? That I think what was hard for me emotionally about living with HIV before I was undetectable was the idea of being a source of fear and contagion to others. And while that might have been largely in my head, it was very hard to shake that feeling that I was an object of fear. And while there are profound differences between COVID and HIV, I think that subconsciously we do carry this fear, not only that we're going to get sick ourselves, but that we're going to make somebody else sick. We're going to be the cause of an outbreak. We're going to contribute to a super spreader event. And so being vaccinated in the same way that, being successfully treated with antiretroviral medication, it takes that fear away, and it restores a piece of your humanity. And that's what inspired me to write about it. It dawned on me that by doing my unique version of a kind of vaccine selfie, I could also help to contribute to breaking silence and stigma around HIV if I shared with the world that the reason I got vaccinated is because I was eligible due to an underlying health condition of living with HIV. So that's what I decided to do. And I took a picture of myself and I tweeted that I got vaccinated today because, newsflash, I've been living with HIV for 11 years. And I've never lied about my HIV status, and my family and many of my friends are aware of it, but I've never been public about it in that way. And the response to that tweet was so powerful and overwhelming. Just the feedback that I got, the outpouring of love and affection and appreciation and gratitude, that I was confronting HIV stigma at the same time that I was promoting the COVID vaccine, was so overwhelming to me. And a friend of mine said, you really should write about this. I did it because I saw for the first time a tangible opportunity to help people by being public with my HIV status. I don't think I would have done it, to be honest, if I wasn't confident that the reaction would be positive. And that's just the nature of self-acceptance. And it took many years for me to accept what was always true, which is that people who love me, people who care about me, aren't going to judge me for being HIV positive. A number of people with chronic illness or disability wrote to me to say, thank you for breaking the silence and stigma around disability. I had people in different countries from around the world saying, your essay is circulating on social media in this country where so many people are battling with HIV stigma still. I had a couple of friends write me and share that they had lost friends to HIV and AIDS because their friends were too ashamed to come out, too ashamed to seek treatment. And so they, in a sense, died of their shame. Take your time. You have nothing to hide, but you also have nothing to confess. And it is only once you fully accept that this is private and it's yours to share, that ironically, you will feel like you can share it. And if my experience is any indication, and everybody's different, maybe wait and see if there's an opportunity for sharing it to really help other people. Because I have found there is no better way to deal with shame than to be of use and to be of service. And I've actually known that for a very long time. When I was first diagnosed and I was terrified, I went to a support group at Gay Men's Health Crisis, and just hearing and witnessing how my words and my story helped other people, landed well with other people, it just helped me feel less ashamed. And I think there are strong resonances. The way that in the past year, we were all wondering, how the heck is this thing transmitted? What makes people contagious? Is it fomites? Is it droplets? Is it airborne? This idea of a plague, of contagion, of the way that that creates fear, of the way that fear divides people and creates suspicion. What's the difference? As AIDS activists, we have to recognize and be very concerned about the way in which COVID-19 and COVID-19 countermeasures are interrupting access to HIV services as a result of social distancing and as a result of, in my view, narrow-minded decisions to curtail some of those services for public health reasons. And UNAIDS just today came out with an estimate that the benefits of continuing HIV services in the face of COVID outweigh the risks by a factor of about 100 to 1. So it's just such a critical time to redouble efforts to ramp up HIV testing, treatment, all manner of services, not just in spite of, but because of the COVID-19 pandemic.